about to dive into one of the most underrated areas of injection, the chin. Let's be real, the chin doesn't get as much love as it should. But before we get in, if you could take a quick moment to help me reach my goal of 1,000 subscribers by the end of the year, I am getting so close and I love recording these videos. If you could take a second and hit that subscribe button. I would say the most common treatment that patients are coming and requesting is lip filler, right? It's kind of that gateway into injectables. They're comfortable with it, it's kind of mainstream, and they see it a lot in social media. So they come in and they're like, okay, I want my lips augmented, I want them more plump and luscious, and it's easy for them. So they come in for lip filler, but they don't have that aesthetic eye like we do as an injector. So they may not be picking up on other areas that could help balance out their features. So, what I like to do is perform a full facial assessment for them and point out some things that I think would help make them feel a little bit more beautiful and balanced. So, pointing out a chin and evaluating a chin when you're augmenting lips is incredibly important. You do not want to neglect a chin. So, when you are evaluating somebody's profile and you plan to augment the lips, even though you're not trying to make them look like a duck, you are still adding volume to those lips. So they are going to project out ever so slightly, even if you're only adding a small amount of filler. So you always want to make sure that by augmenting their lips, you're not going to force their profile out of balance, especially if they already have somewhat of an already weak chin. So it's incredibly important to evaluate not only the frontal view of them, but their profile as well. This is how I evaluate a chin. I like to use a line called Ricketts line. And Ricketts line is when you take a line, an imaginary line, from the nose down to the chin. So let me get in my profile view, nose down to the chin. And you touch the nose and the chin. And your goal is that lower lip is 2 millimeters behind this line, and the upper lip is about 4 millimeters behind this line. Now, I do want to point out that this is a very much old school Caucasian guideline. So you want to take that into consideration because oftentimes what we're seeing is the more modern ratio of lips is a 1-to-1 ratio, where classically it was a 1-to-1.6. That bottom lip was a little fuller classically. So you really want to use these guidelines, but also use your aesthetic eye and say, you know what, this doesn't match what the facial proportions or features are of this patient. So I need to use my aesthetic eye to see if they could benefit from a little bit of chin projection or chin contouring. If this is a more Caucasian, more classic featured patient, then you could utilize this Ricketts line. So let's see. So my lower lip pretty much touches the line, and my upper lip sits a little bit behind because I have a fuller lip. But you can see if I were to project out my lips any further, it would naturally make my chin look recessed. I don't have kind of an issue with chin projection for my features personally, but if a patient came in with a more recessed naturally chin and a weak chin, and then I augment her lips, it's only going to make that ratio look even more dramatic. So it's important to look at that profile, utilize Ricketts line, and you'll see if they have a weak chin, this line will have to push backwards and match that chin. And you'll see that the line will look more like this. And balancing out, if you're augmenting their lips, you have to consider projecting out their chin. These are some examples of a weak chin. So the patient came in wanting lip filler, and we evaluated their chin first. And I said, you know what? I see that you do want lip filler, but you know what I think would absolutely balance you out even more is actually projecting out their chin. And you know what happens oftentimes is the patient will be like, I've always felt like I had a weak chin, but I didn't know that I could do anything about it. They don't realize that this is an option. So pointing it out, I don't want you to feel like you're pointing out a problem of theirs. You're there to help them. And oftentimes, if we don't point it out, then they're going to feel like something is off. They're going to feel like something is not in balance, but they don't really know what that is. So it's our job to educate them and say, hey, you know what? I think if we are planning on adding into your lips, I think if we were to project your chin out a little bit, I think it'll help make you even look more balanced. And oftentimes, if a patient is really unsure about how that'll look, because we think chin filler, right? And we think we're going to have this like witchy chin. And we're seeing that a lot these days, right? We're seeing a lot of patients come in with this sharp, exaggerated, witchy chin, and it looks horrible. That is not what I'm talking about. I'm not talking about dramatic contours to the chin. I'm talking about balancing out natural features. And my personal preference and my aesthetic eye isn't drawn towards a harsh chin for a female. Remember, the width of a chin for a female is typically in line with the nasal ala, and the width of a chin for a male is typically wider in line with the oral commissures, because you want that male chin to be more square and wide, and you want that female chin to be more tapered. So you really want to look at the patient's features and really determine what's going to be best for them. That's what really sets you apart from the injector down the street, is when you're really factoring in what's going to be best for them, and you're not doing this weird blanket witchy chin on every single patient, making everybody look the same. It doesn't look good. So talking to your patient and being comfortable bringing things up that maybe they weren't thinking about. And because I think that ultimately they know what they see in the mirror, but they can't kind of eloquently say it, or they can't put it into words what they're seeing as being weak on their face. Now, this patient in particular came in for chin filler. She came in and she was like, you know what, Alexis, I have a really weak chin. I feel like my lower face is completely cut off, too short. So I really want that chin projection. So for her, we didn't even augment her lips. We went straight for the chin, utilizing needle technique, and projected it out with a syringe of filler. And it looks absolutely beautiful. So let me walk you through exactly how I perform this technique. So when I'm performing this technique, I love using a 27 gauge by 3/4 inch needle. I actually love using the needle that comes in the Radius box. It's my go-to needle for so many areas of the face. If I'm adding projection to that chin, I'm taking my time. I'm standing in front of them, marking them out, standing in their profiles. You could see I'm looking crazy looking at their profile. I'm really trying to map out exactly where I want that projection, because you can project completely um, forward, or you can make their chin appear longer in the frontal view by sitting more inferior to that bone. If you want to be projecting their chin out in a more forward projection this way, then you want to sit more superior on that bone. Or if you want to drop it down and give them length, lower length, then you would sit lower. So it's important to understand where that needle is going to be, and really mapping out where you want or where you feel they would benefit most from as far as that projection is concerned. For this patient, truly she can benefit from a little bit of both, right? So I go right on bone. I always like to start with a little bit of lidocaine just to numb the area, because it is a little tender after you do a few pokes. So my first poke is always a little bit of lidocaine just so that she feels a little more comfortable. And then I go in with my needle and my syringe. So I go directly on bone, going straight in the middle center part of that chin. I go all the way on bone until I engage with that bone, and I stay right there, and I aspirate for about 6 to 10 seconds. I never push any product in this area without aspirating. I cannot explain how horrifying it is to have somebody show up at your office with a chin vascular occlusion. I haven't experienced it on a patient myself, but I have helped treat a chin vascular occlusion, and it is horrible. It is such a horrible experience. So once you see one once, you're like, I'm taking my time. So my rule of thumb is, one, I aspirate. And if I feel like when I'm aspirating, I pulled off that bone, then I'm going to re-engage with that bone and aspirate again. I do not take any chances. And then I only inject 0.2 cc's at a time. You will never see me inject a full half syringe in one bolus. I'll do 0.2 cc's, come out, massage, evaluate the skin, check in with the patient, and then I'll go back in. My thought process is that I'd rather inject the patient multiple times and poke the patient multiple times than put a big bolus, a big wad of filler into an artery, and God forbid something were to happen. So 0.2 0.2 cc's at a time, aspirating for 6 to 10 seconds every single time. And I'm constantly evaluating their pain and any skin changes. And I run through a full vascular occlusion spiel before I inject these patients, and I explain to them what they'll experience, what we would need to do in the event of a VO, and then God forbid symptoms were to present later, I tell them exactly what they need to be looking for. So they are ready to give me a call if God forbid anything were to happen, because we think in the past, or we thought in the past, that if we stay center on bone that we're safe, but we're seeing more and more and more and more patients present as anomalies, that these anomalies are actually more common than we think, and it's not an anomaly anymore, it's actually just common anatomy. What we're finding is that that submental or mental artery, although they sit more laterally typically, they'll have connections to each other that run centrally. So you'll have a mental artery on either side, and then they'll have a little feeder that meets centrally, and that's what you can occlude when you're on bone centrally. So it's incredibly important to not have this like blanket idea of, oh, if I'm center on bone, I'm safe. We're finding more and more often that that's not the case. So for this area, I'm even inclined to check on them after. How are you doing? How are you feeling? Do you notice any skin changes? Because this area is such a tight compartment that you really want to make sure that that patient doesn't, obviously with any area of injection, doesn't experience a vascular occlusion. While you're injecting these patients, they'll feel some good amount of pressure because it's such a tight compartment in this area. So constantly checking in with your patient and informing them that that pressure is a little normal, but pain is not normal. So again, for this particular patient, I want some really good forward projection on her chin. So I am really focusing all of my 0.2 boluses straight in the middle of that mentalis area or chin area centrally. I don't need to widen her chin. She doesn't need width in her chin. Remember, female chin is here, male chin is here. I'm truly just trying to benefit her profile view and give her a stronger chin. So my projection is going to be this way for her. So 27 by 3/4 inch needle, 0.2 boluses at a time, consistently checking in with my patient is my go-to technique. One thing I always like to add on for a patient is sometimes what you'll see is that, yes, they have a weak chin as far as projection wise, but sometimes I like to actually tox their mentalis first prior to injecting filler, because oftentimes what you'll see is that, remember that mentalis helps support that lower lip. So you'll see a patient with a weak chin often working overtime in that mentalis, and that mentalis is kind of puckered up. What I notice is that if I relax that mentalis with a little bit of neurotoxin and then bring them back in for filler, it lays so much more beautifully, because if they have a really hyperactive mentalis, it's almost like that mentalis isn't going to allow that filler to kind of lay nicely. So if you relax that mentalis and kind of drop that mentalis down into the bottom of the chin and then lay filler, I've found that the results are 10 times more beautiful if they need that. Now, if they have a soft mentalis and it's not puckering up, then go straight to filler. But typically, I love offering a little bit of tox, seeing if we can soften the appearance of that mentalis and that cobblestoning, and then I'll bring them back and add in however much filler that they would need. So if you're an injector, don't neglect the chin. Always discuss the chin with the patient. It really is such a game changer. And if you're a patient wanting a little lip augmentation, take a look at your chin and see if you feel that it can balance out with a little bit of filler, and discuss this with your injector. But if you're loving these videos, please hit the subscribe button and help me get to 1,000 subscribers by the end of the year. I absolutely love, like I said earlier, filming these videos for you guys. So please don't hesitate to comment if you have any questions, or if you want to critique my technique. I am humble and I'm always wanting to learn, so don't hesitate. But thanks for tuning in.